in a child and youth state, there is this sense of sort of moral good that we've been able to, I think, quite effectively instill in people. But really, the awareness about adult vaccination peters out, as we've seen, at least in our country and in some comparator jurisdictions. By the time you're in your 20s and 30s, you really stop thinking about adult vaccinations unless you're traveling somewhere where one is required.
There's been a focus on children, which is very, very important. But now, there's still, I think, huge gaps in the understanding amongst adults about what vaccination can do and how important it is in later life.
There are situations that has been highlighted that even the older age they need it for diseases like preventable diseases like pneumonia, flu, influenza, and so on. I think first the advocacy has to be done on the acceptability that yes, this vaccine works and it will help you.
I think the next steps has to be finding a way of actually thinking about whether we've got the messaging about vaccination right. We need to better understand how we communicate the benefits of adult vaccination to older people. So perhaps we need a much more positive message around health and well-being rather than a sort of more negative message around old age being essentially about deterioration.
So I think one of the main things that needs to be done in terms of awareness is linking in issues that can be prevented, such as flu, through the seasonal flu jab, into healthy lifestyle choices. That can be about, just like you take your multivitamins, you go for a run, you go for a walk, you keep active. Part of that needs to be leveraged to include preventative measures.
But it's very important that in many settings we spread the word, and today's seminar made me feel that that's even more important than I'd realised, because there's a lot of ignorance, there's a lot of feeling that, well, you haven't got flu, you haven't had flu so far, and it's really about children, and once you get to a great age, well, you're just not going to get it. But we know to the contrary that it can be absolutely disastrous. We have to do something.
But it's really important for policymakers across the world to realise that actually the world is getting older, both in the developed and the developing world. We're seeing more and more of us living much longer. It's a brilliant success story for in terms of public health and for the world in general. But what of course that means is we've got to make sure we are ensuring that we're living, not just living longer, but living longer healthily.
We know that prevention is the key. We know that vaccines are pennies on the hundreds of thousands of dollars, pounds, euros, or any other currency. And we know that if people are vaccinated, they stay healthier longer.
For policymakers, what they have to do is make sure that we are using the science, understanding why older people aren't being vaccinated, and make sure that we increase the uptake levels, whether it be around flu vaccination, pneumococcal, or shingles.
We can't stick to the same old approach. It can't just be the same old public health campaigns featuring people with grey hair, with sitting in those sort of laid-back chairs with wrinkles holding their hand. It needs to be a much more positive image. People need to buy in, they need to understand that this is for them, but they're not going to want to if they see this being for old people and they don't see themselves as old. This needs to be a positive lifestyle choice, and policymakers have to understand that.
I think that we look too much at individual diseases rather than what is the burden of diseases in older adults generally. Understanding where the opportunity is to intervene and measuring the impact of immunization on a variety of different health issues rather than just one infectious disease.
I think there should be harmony between the government agencies so that altogether with non-governmental organizations there could be a kind of synergy to improve the awareness and the acceptability among the public.